Welcome to the podcast, The Whole and Complete Woman, where we provide practical tips and strategies for achieving your health, wealth, and relationship goals and desires. Yes, I said desires because God does not put desires in our heart just to tease us. So it is important to me that you are empowered with the tools and resources to not only fulfill your goals, but to create a life you love and create a legacy. Because the people who come after us, they are depending on us to pave the way. So I congratulate you for being here. Not only will today's content help your future self, but also those that come behind us. And that looks different for everyone, which I love. Today, we have Dr. Kela Smith with us today. I am so excited to have her here. Dr. Kela Smith is PhD, Doctor of Natural Medicine. She is a holistic doctor, researcher, and educator, and the founder of the Hormone Puzzle Society, a virtual clinic and educational platform supporting individuals and couples on their fertility and hormone health journeys. After navigating and overcoming her own infertility and hormone challenges, Dr. Kela transformed her personal healing journey into a mission to help others uncover and address the root causes of infertility and hormonal imbalances through a whole body, evidence-informed approach. Her work focuses on hormone signaling, metabolic health, gut immune balance, detoxification pathways, and nervous system regulation as they relate to reproductive outcomes and hormone balance at every age. She is the host of the Hormone Puzzle podcast, where she shares expert interviews and stories of hope, hosts the fertility challenge or the fertility coaching mastery podcast, where she teaches practitioners how to start, grow, and scale a profitable and purpose-driven fertility coaching business. And she's the author of a book that's already been published. I have it here, Solving Your Infertility Puzzle, a comprehensive guide to optimizing your fertility. Dr. Kela is also the founder and lead educator of the Hormone Puzzle Society Educational Institute, where she trains and certifies future fertility and hormone coaches, and is a sought-after speaker at conferences, summits, and professional trainings. Dr. Kela, we are so excited to have you here today. Thank you for coming on the show.
I'm really excited too. This is going to be a great conversation.
Yes. So tell us a little bit about your story and how did you get started working with women that are dealing with fertility issues?
Sure. So it started out of my own personal journey through infertility. I got married. I thought it would be very easy to get pregnant. We're told our whole lives just to, you have sex and you get pregnant, and that's how it happens. And for us, we learned that that wasn't going to be the case and it wasn't going to be that easy. So we started with our conventional medicine doctors and, ran the tests and did all the things and was told at 36, because I was advanced maternal age, that IVF would probably be my only option to get pregnant. And in the other breath of that, told that I had unexplained infertility. So I left that doctor's office being very frustrated, thinking, I'm going to figure this out because I'm 36, I'm not 56, and I'm going to see what I need to do to get as fertile as possible. And that's what I did. I dove into research. I thought what I needed to do to heal my body and to optimize. And I ended up figuring out what was causing the issue. I got pregnant not once, but twice, had 2 babies, my last at 40. And then I went back to school and thought I have to teach this. And so with a newborn and a 2-year-old, I started to pursue my credentials and started my practice. And that was in 2016. And now I work with women and couples all over the world. I help them figure out why they're not getting pregnant, what they need to do to heal. And I help them heal and optimize so that they can get and stay pregnant. And then also, as I'm transitioning in my own life through perimenopause and menopause, I'm also noticing that there's a huge population of people going through menopause that are told that these symptoms are normal and you just have to suffer through it and it's just part of life. And I'm here to tell you that's not true, that there's so many things that we can do to heal and feel amazing as we go through that transition.
Yeah.
So that's a little about me. I've written a bunch of books. My latest book just dropped on March 11th called Solving Your Fertility Puzzle. I'm the host of the Hormone Puzzle podcast, and I just love talking about just holistic health and how to heal and feel amazing at every age.
I love that. The work that you do is needed in all the different phases and journeys that we
Yes.
go through in life. Now, you mentioned a little bit just now about like moving through perimenopause and into menopause. What are some of the
Mhm.
key things that you have found? And what is your perspective on HRT and peptides?
Yeah. So the key things that I found, obviously our hormones are going to start to become erratic, and that can give a lot of symptoms. And so, going and knowing that, but also knowing that there's things that we can do to optimize our health so we can minimize these symptoms and we can transition through these phases in a very easy way, and then almost, hit menopause and still feel amazing. And so I always like to, before I even talk about HRT and peptides, first, these are not quick fixes. These
Yes.
are tools in our toolkit. So before we even start with either one of those, we have to have foundations in place. We have to make sure that we're eating a whole food balanced nutrition diet. As women, especially as we age, we need more protein. So we have to eat enough protein. I recommend you have a gram to a gram and a half of protein per pound of body weight. So that's for most women over 100 grams a day. We have to make sure we're eating enough calories. This is another one I see a lot of, especially high performing women that are busy. We don't eat enough. We work out a
Yes.
lot. We don't sleep enough. We are just going, going, going. So we have to make sure that those foundations are in place before we even look at HRT or peptides. But then once all of that is in place, I do think these are great tools because, as I said earlier, as we age, our hormones are declining, they're becoming erratic, our body stops producing as many hormones. As we go through menopause, our ovaries are no longer producing estrogen, our testosterone declines, our progesterone declines. And so I think replacing that is important. I'm a big fan of HRT. I think working with the right practitioner who knows how to do dosing is really important. So I do think that there's a place for that. And then peptides is also another tool that I think it's a tool. You can't, I see people talking about taking peptides and then they're eating terrible and they're,
Yeah.
drinking sodas and alcohol and doing all the things that are jeopardizing their health. And so for those people, peptides are probably not going to work. And if they do work, they're not going to sustain the results you get. So for those listening, peptides are just signaling molecules. They're naturally produced in our bodies. As we age, we that signal gets blunted and we stop, the signal isn't as strong anymore. And so we can add peptides into our bloodstream through, sub Q injections, some are intravenous drugs, some are even oral. But we put these signaling molecules back in the place. And so it tells the body, things to do: build muscle, burn fat, heal tissue, heal the gut. There's peptides all throughout the body. So I do think that they have a place. If you have your foundations in place and you just need a little help from one of these tools or both, I think, they can make you feel really good as we go through our transitions in perimenopause and menopause.
Yes. Do you have any preferences when it comes to, subcutaneous or oral or IV and things like that? There's a lot of, you know, lots of information out there for people.
Yes. So it depends on the peptide, but sub Q for most peptides are going to be the best delivery method because it's going straight into the bloodstream and it's bypassing the gastrointestinal tract. When something goes through our gastro system, it's broken down and it's not as strong. And for some people, they're like, I don't want to do sub Q injections. So maybe oral is their only option. But if you choose either option, I think sub Q is going to work a lot better because it's going to be delivered right into the bloodstream and that signal is not as weak as it would be if you do it orally. And then when somebody is doing it intravenously, they have to work with a practitioner. There's certain peptides that you can use for this in certain settings, like in a cancer setting. Some of these are used, but definitely always with an MD or DO or some licensed professional that can deliver those peptides in the right dosing for you. But if you're just somebody at home, working with, say, a practitioner or a med spa or somebody like that where you're doing it at home, I think sub Q is the way to go.
Okay, so oral and sub Q, those are things that people can do on their own at home.
Yes,
Okay. And
exactly.
for the audience that's listening, they may be like, "Oh, wait, hold on. What's sub Q? What's that mean? Can you tell us?"
Yes. Yes. So that just means it's in the fat right under the skin. So it's a little bitty tiny insulin needle that you inject into that subcutaneous fat. So a lot of times we'll do it in our stomach where we have a little bit of extra body fat. Some do it in the glute, that piece of fat that you have on the side of your body. Yeah. So, because you
Yeah.
want it in that tissue that's, meaty and has some fat to it.
Nice,
Yeah.
nice.
Mhm.
Now, there's information about that, about peptides out there. People are kind of getting them on the black market or, maybe some places that seem a little sketchy. What do you recommend, like the best place for people to be able to know that they're getting reputable peptides?
Yeah, so, all peptides come from China, so there's that. I do recommend that whoever you work with, you make sure that you see something called a COA, which is where they've got a licensed document showing the purity of the peptides. Some companies will do third-party testing to test for metals and toxic materials within the peptides, so you always wanna look at that no matter who you go with. Now I will say that most people do want to go through places where you can work with like an RN or a licensed professional. But I will also say, for myself, because I am in the healthcare space, I've ordered peptides for myself and looked at all of that COAs and the references, and that's okay. So it really just depends on how much knowledge you have around peptides, how much research you've done, and if you feel comfortable going with either, a med spa or a licensed practitioner, or you want to kind of order on your own through a reputable company.
Nice, nice.
Yeah.
So tell us a bit about your journey in business.
Yeah,
You train other men and women, I guess. There may
I
be some
do.
men that want
Yes.
to do it as well. And they become a part of your Hormone Puzzle Society. Tell us
Yes.
about that.
So I created a fertility and hormone coach certification program so that I can certify either lay people who have their own fertility journey that want to work in this field, or I can work with other practitioners who are in the wellness space that might not be certified in fertility coaching. So people that want to add fertility coaching to their practices and work with the 1 in 6 women and couples globally that are struggling with
Wow.
infertility. And so I looked for a program like this when I was first getting my credentials and nothing existed. So as I was working in practice in my first couple of years, I kept having people come to me that were health coaches and nutritionists and different, people in the holistic health space that wanted to know if I could train them and teach them and mentor them. And so I said, well, I'm going to create a program. And so that's what I did. And so that happened in
Nice.
2019. And we've run hundreds, if not thousands, of students through this program. And many of our students have huge successful businesses. And so I teach, not just the clinical pieces and how to work with patients and clients, but also the business and the marketing and the mindset on who are you becoming
Yeah.
as you step into this role as a clinician, a practitioner. And so it's a wonderful program, and I'm really proud of it.
Wow.
Yeah.
Wow.
Mhm.
What a beautiful way to just expand impact,
Yes,
Like
exactly,
there's only like
exactly,
one of us, but when we're able
exactly.
to duplicate the work that we do and help
Yeah,
other people, we're really like changing the world one person at a
yeah,
time.
for sure.
So tell us, what does it look like if someone comes and works with you or with one of your practitioners? Like what does their process look
Yeah.
like? How do they even get started?
Sure. So the first would be to book a telehealth appointment with myself. And so you can do that right from my website at hormonepuzzlesociety.com. And on that call, I call it a deep dive call because I have you fill out a 57-page health history form and give me any previous lab tests that you've had that are less than a year old. I review all of that data. And then on the call, we talk about what do I see are the root causes of why you're not getting pregnant and how can we work to heal and optimize.
Yeah.
And then based on that data, I will recommend, if you need further lab testing, if you need functional lab testing like a Dutch hormone test or microbiome analysis or a DNA test or a mycotoxin test, whatever testing you might need. And then also what protocol you need. Do you need to work with us for 12 weeks? Do you need to work with us? Do you need to go through a detox program? What is your health history telling me? And what are the clues that I'm seeing? And then that's what we would discuss on the call. And then if you decide to work with us, we work for 12 months. And after that, we have a continuity program. And so, we have a wonderful success rate. Many of the people that work with us end up getting pregnant naturally. Some people come in wanting a better success rate with their IVF, and the next cycle is a success. We even work with patients who are going through egg freezing and, have helped them get many, many more eggs than they did on their first couple of rounds. So,
Nice.
yeah, so that's a
Nice.
little bit of our process.
Such an exciting and stressful journey that women go through. I know the ones that come to me as well for similar issues. It can be very stressful. It can be a time where women are feeling shame. They may feel like they're broken, that things aren't working in their body. They may have regrets from past relationships, all different types of things. Are there any
Yeah.
things in particular that or advice that you would give women that are going through this journey and maybe struggling with um, some of those mental things that go through their mind?
Yeah. Well, first, I just want to say that you're not broken, that you do have the power to heal. And it does start with the belief that you can and will heal. So, anybody listening, I want you to just take a step back and really lean into that statement and know that you can heal and that you have the power to do that. There's so many practical pieces that you can implement just from home. Many of them are free, starting with, your nutrition and lifestyle and mindset. So that's really the main thing I want, women and couples and whoever's listening to this show to hear that you can heal and you do have that power.
I love that. So tell us a bit about the foundational pieces. You had mentioned it a little bit
Sure.
before, but tell us what are the
Yeah.
foundational pieces and how
Yeah.
can women begin implementing them in their life?
Sure. So I created something called the Hormone Puzzle because I love an acronym. And I found a lot of stuff was happening to me when I was going through my infertility, and I wanted to take back some control. And I'm a type A, and I was like, tell me what to do. I need to know what to do. So the
Yeah.
Hormone Puzzle is all of those pieces that you can focus on every day in your own lives, in your own homes. And so the puzzle stands for P, proper whole food nutrition and hydration. U is understanding supplements. Z is Z's or I'm sorry, Z is zapping stress. Z is Z's or sleep. L is love and encouragement. E is exercise and environment. And so these are all the pieces that you can focus on every single day. And like I said earlier, a lot of these are free. Some of them you're already doing. And so it's just about optimizing those pieces. But so that's the foundation. And if you're working on that every single day, your picture of health will start to come into focus and, you will begin to heal.
I love that. So all of that is like inside of our
It
our
is,
books here.
yes,
So
and much
ladies,
more details, and I go through, the nutrition piece too. I go through all the nutrients that you need in fertility and, for hormone health. I go through a whole section on detox. I talk about minerals and, there's just so many pieces in that book.
nice. So tell us a bit about genetics. How do genetics play in with women that are dealing with fertility?
Yeah. So there's a couple different things. So you can get something called PGT testing, which is looking at being a carrier for a genetic disease. So these are things that we look at within, as we're looking at eggs and embryos. And so we can test for that. But what I do as a functional medicine doctor is I look at your DNA and your DNA SNPs, and I look at how can we turn on things that are going to optimize your body, such as do you have a SNP for how you're able to methylate your B vitamins? Do you have a SNP for how you're able to produce progesterone? Looking at all of these things that we can do to optimize the body based on your DNA SNPs or your polymorphisms. So, and there's actually testing that I can do looking at your DNA SNPs specifically for fertility and pregnancy. And so that's a really good tool to have to look at how can we optimize based on your genetics and your fertility journey.
I love that. I love
Yeah.
that. So it's more about turning genes on or optimizing. Tell us about that.
Yes. Yeah, so that's epigenetics, we're turning genes on. And so like I just said, some of those genes are things like your MTHFR gene. If you have those SNPs, we need to make sure we have a really good methylated B vitamin on board. Some of the progesterone, if you have those SNPs, you might be more apt not to make as much progesterone as somebody who does not have those SNPs turned on. So we need to make sure we're optimizing for that so that you have a good progesterone production. I'm trying to think of the other ones. There's a fat gene where it controls how we utilize our vitamin D. And so if we have that polymorphism turned on and that epigenetics is working, then maybe we need more vitamin D or more fat soluble vitamins, adding in more fatty fish and mushrooms and even vitamin D supplementation. So yeah, it's really cool. Yeah, there's many different SNPs. I think it's 15 to 20 SNPs that I can look at on that genetic test. So yeah,
Nice,
it's really
nice.
cool.
So,
Mhm.
what are your thoughts on things like seed cycling and eating for your menstrual cycle and like all of that? Is that helpful for women?
Yeah, I think it can be. I really like those. Again, that's a tool. And I think
Yeah.
those nutrients based around either seed cycling or cycle syncing, those nutrients are helpful during those phases of your cycle. And so, yes, I think they are wonderful tools. I also, I don't want people to get hung up on that because I see a lot of patients saying, well, I can do it wrong. Like I'm not in that phase of my cycle and I ate that food. So I've done it wrong. I've messed up my hormones. And it doesn't work like that. I was
Yeah.
talking to a patient earlier. It's only helping you. These nutrients are only helping you. They're not ever going to hurt you because it is whole foods. So even if you eat one and it's the wrong phase, you're not going to mess anything up. But just try to be mindful of, okay, I'm in this phase of my cycle. These are the nutrients that are good for that phase. Let me see if I can add a couple of those foods in. It's never about removing, it's always about abundance and adding.
I love that. Yeah. So you
Yeah,
can't go wrong if you're eating your sunflower seeds or sesame seeds or
exactly.
pumpkin seeds at the wrong time of the month. They're
Exactly.
still there just to help
Yeah,
and support you in general because they're whole foods.
exactly. Yes.
So tell me, are there any things women can do? I know for me, when I was growing up, the main thing was like, don't get pregnant, you know,
Mhm.
and same thinking as you, like you have sex and you get pregnant, like
Mhm.
that's how you do it. So when you're growing up, you're like not supposed to do it because you don't want to get
Right?
pregnant.
Yep.
Because if you do, you're going to get pregnant. And it
Uh-huh.
doesn't quite work that way. We have different
Doesn't.
phases of the menstrual cycle and the ways that our body changes. What are
Yeah.
some of the key things that women can do to help understand their menstrual cycle and when they ovulate?
Yeah. So the first thing is you want to track the cycle. So many of my patients will come to me and they're not even doing the basic tracking. So, what do I mean by that? We want to know how long the menstrual cycle is from the first day you bleed until the day before the next day you bleed. So, that's the length of the entire menstrual cycle. Then we also want to know the length of the bleed week, the menstruation week. We want it to be 3 to 5 days in length. We want it to start out as spotting, get heavier. It always be, bright red blood. We don't want a lot of clots, no clots bigger than, say, a nickel or a quarter, not any bigger than that. There shouldn't be a lot of pain with the menstrual cycle. If you're in bed and you're taking, ibuprofen and you can't go to work, then we need to get that checked out because there's something going on
Yeah.
there. It should not be painful like that. We need to look for, endometriosis or hidden signs of inflammation. So the menstrual cycle should be pretty pain free, minimal symptoms. Then as we're going into, so that's the first phase, is the menstruation phase. Second phase is follicular. This is when your estrogen is rising, your follicles are starting to grow, the dominant one is about to come on board and release that egg. So that's called the follicular phase, and that's usually day like 6 through 13 of a 28-day cycle. So then once we get to ovulation and that egg busts out of that follicle, that is called ovulation. And that's usually about a 1 to 3 day window. You ovulate within that time frame, but the actual releasing of the egg and how long the egg lasts is only about 12 to 24 hours. So I always tell my ladies, if you're trying to get pregnant, you want to be having sex before ovulation and you want semen in the reproductive tract before you actually ovulate. Because if you miss it or if you ovulate overnight and you only have 12 hours, then you've missed that cycle if you're trying to get pregnant.
Yeah.
Same goes for if you're trying to abstain, or if you're trying to not get pregnant, then I would just abstain during ovulation or use something like a condom or, a barrier of some sort so that the semen and the egg are not meeting. And there's a really small window each month that you can actually get pregnant. It's really just like that 2 to 4 day window. So it's a very small. So if you are in a committed relationship, say you're married or in a committed relationship and you don't want to abstain, then you just, it's not a very long time. It's not like you're abstaining half the month. So and then so that's follicular ovulation is those 2 days in a 28-day cycle. It's usually day 14 through 17, somewhere in there you'll ovulate. And then on the back end, we have the luteal phase. And we really want the luteal phase. I like to see 12 days of a luteal phase, no less than 10, but 12 days is really optimal. Even, we can even go to about 14 days, all the way up to a 35-day cycle is still considered normal. Most women are going to be like 27 to 30 days is where they usually fall. But that's different for every woman. And it can be different every cycle, depending on how you lived your life that cycle, how much stress you're under, how much you're hydrated, all the things. So that's the luteal phase. And then the luteal phase is broken into 2 weeks. 2 weeks before your cycle, you still feel pretty good. You still have the energy off of ovulation. But then as you go in that week before your period, that's when, that's kind of like your report card for the month. If you have a lot of symptoms, then I want you to look back into that month and say, how was I eating? How was I sleeping? How was I hydrated? All the things.
Yeah.
But you should have minimal symptoms. So that kind of, and then one other thing I forgot to mention. So for ovulation, you can also track something called cervical mucus. And so this is usually starts to come in the follicular phase. You'll start to notice some women get like a more thick consistency, but then as you move into ovulation, it should turn into a more egg white, stretchy. Some women do see it come out in their underwear. Some women just feel it when they wipe. If you're not seeing it come out, when you wipe, it's going to be more slick. When you can tell the difference between wet urine versus slick cervical mucus. So watch for that. That means you're right on top of ovulation. You'll ovulate within 36 hours. So kind of watch for that. And then as you go through ovulation, the egg comes out of the follicle. You go into that luteal phase. Once you've gone through ovulation, the cervical mucus will start to dry up. But then that's when, if you are doing something called BBT tracking, which is basal body temperature, that's when your temperature should start to rise. You want it to rise 3 days in a row. That confirms that you ovulated, because the reason it rises is because the follicle that you ovulated from is called the corpus luteum, and that releases progesterone, and that's what causes the temperature to go up. So if you didn't ovulate, you're not going to release the progesterone, and the temperature is not going to go up. So that was a long answer, but
I
hopefully
love it.
that
It is one of my favorite topics,
me
talking about the
too.
menstrual
Hopefully
cycle and all
that
the phases and our
yes,
changes
yes.
in our cervical fluid and basal body
Uh-huh.
temperature, all
Yes.
of that. All
All
right.
the things.
Now, biohacking is a really popular thing, and there's all types of things that, go cold plunge and intermittent fast, and all of those can have their place. What are your thoughts on that with women dealing with fertility?
Two things. First, all of the studies, I think, you can quote me. I mean, you can check this if it's not right, but from the research that I've done, all the studies on those things have been done on men. There's very few studies done on women. Second thing is, I feel that is all very hard on the nervous system. You never want to do anything that's going to jar the nervous system, especially when you have such, volatile hormone fluctuations like we have during infertility, like we have during, as we go into perimenopause and menopause. So I'm not a fan of cold plunging for women at all. I know some women are going to like yell at me for saying that, but
Yes.
I just think it's too hard on the nervous system. So
Yeah.
I don't think the benefits outweigh the risks. So I would say skip the cold plunging. Now, intermittent fasting, you can do that overnight. I've seen some good success within my patients where, you stop eating around 7 p.m. You don't eat again until, between 7 and 9 a.m. I think that that's fine. We want to give the digestive system and the body rest while we're resting to kind of repair and rejuvenate and renew and have the cell turnover. But I do think if we do it longer than that, you can get in trouble. And I know there's the argument with autophagy, and that's great, but it's jarring for the nervous system. And I think, especially for women, because we constantly undereat anyways, that when you throw in intermittent fasting, now it's almost like you're in starvation mode, and you're like, restricting yourself, and your body needs food to make hormones. And so I say skip the long fasts. If you want to do intermittent fasting, do it for 12 hours or, 14 hours, and that's it. So,
Especially for women that are dealing with fertility. Like a lot of
yeah,
times there's that nervous system dysregulation that's already an issue, high stress. And while those things can be like hermetic stress that can be beneficial, it can have its benefits, it can just create more undue stress on the body. And I always say, if you were in the forest and there was a bear running after you, so your body's in fight or flight, right? And sympathetic dominance, the last thing your body's going to say is like, now's a good time to have a baby, right?
right.
Nope,
No.
not
Mm-mm.
happening, right? So
Nope.
a lot of those things can be too intense on the body. And
Yeah.
there's other ways to, regulate blood sugar and do
Yeah.
all of those types of things that could be contributing to
Sure.
fertility issues. So I share that perspective as well.
Yeah.
Yes.
Good.
So tell us, you have an essential guide to hormones and peptides. Tell us a little bit about that.
Yes. And so there's a lot of questions around hormones and peptides. And so I thought I'm just going to put my knowledge into a little free guidebook. And so I go through, many different hormones and what they are and what they do in the body. And then I also talk about peptides, some of my favorite peptides, what they do in the body. And then I also have some of my vendors in there. And so if you do want to go, kind of rogue and order your own, you can look at those websites. Again, I've vetted these people, but you do that too. Don't ever order until you look at all their credentialing and their COAs. And so, yeah, that's a little guidebook, and it was a lot of fun to put that together. And so, I think it's going to be a great reference for your audience.
Where can women find that?
Yeah, so it's hormonpuzzlesociety.com/peptides-guide.
Love it. Love it. Okay. So tell us, Dr. Kayla, how do women and men who are struggling with fertility, how do they find you and also the practitioners that work in your practice?
Sure. So you can go to hormonepuzzlesociety.com where you can book a telehealth appointment right from the home screen. I also have a lot of different resources. I have a fertility guidebook and meal plan. My podcast is on the website. And so that's the best place to go for the patient side of the business. And then practitioners, that website is fertilitycoachingmastery.com/certification-course. And that will teach you and tell you everything you need to know about our certification course for fertility and hormones, as well as give you a copy of our catalog. Our podcast is housed there. And so you can learn a little bit more about that. And then I'm also on social media. So I am at Kela, KELA_health coach. That's my main Instagram account. And then my new Instagram account is called Become a Fertility Coach. And that is, you can find me there. And I'm also on TikTok at Dr. Kela Smith.
Love it. Love it. Thank you so much for being here today. Thank you for
Yeah.
sharing all of your knowledge and your wisdom. And, women dealing with fertility is, a major issue. So I thank you for the work that you do. I thank you for training other practitioners and just helping to increase the impact of what your work does.
Oh, thank you, Dr. Alicia. I appreciate you so much. And thank you for allowing me to be here.
Yes, yes, yes.
Mhm.
If you want to hear from us more and guest experts on topics like love, health, wealth, and career, we've got you covered. If you're watching us on YouTube, go ahead and subscribe. If you're listening on Apple Podcasts or another streaming service, go ahead and follow us. You won't regret it. It really helps us out. It helps get the word out about the information we're sharing. It's also a way that you can really help another woman. So, one of my goals in having this podcast was to create community and connection. So, sharing this podcast, subscribing, liking, doing all the things really helps us out and the mission that we are up to. Thank you.